today we are discussing an important health topic, especially as it concerns men, that is prostate cancer. I'm your host, Dr. Ima Onyenuche. Prostate cancer, like I said, is a disease of concern to men because men have prostate. It is, yes, cancer, like we said. Once people hear cancer, there is that fear of, am I going to die? What is going to happen? But prostate cancer is one of the cancers that can, if detected early, can actually be cured. So, like all cancers, we always preach early detection. So, it's a cancer that grows in a small organ called prostate. Prostate is at the base of the bladder of men. Just at the base of the bladder, there is prostate. There's an organ there that is called prostate. It contributes to preparation of sperm. It adds something to the semen, so fluid that it adds to the sperm. So when it becomes enlarged, of course, the enlargement can be as a result of other things, but it can be what we call benign prostatic hyperplasia or a benign prostatic enlargement that is commonly known now. It's only when you go to lab that you will now know if it is hyperplasia, but so we call it benign prostatic enlargement. So it can be that one that we call it, we say is benign, meaning it's there, but it's not cancerous, but it can disturb. Then there is one that is cancerous. When it's cancerous, that means it's cancer that is there. Both of them may have similar symptoms, especially if the prostate becomes enlarged. You can, how will the people present? They can present with difficulties in urinating. So you realize that someone says, "Oh, I find it difficult to urinate," or my urine goes small. Sometimes when they strain to urinate, they can't urinate. They need to take it easy, and the thing will be flowing. They can notice that they feel the urge to urinate more frequently. They can notice that they actually, sometimes one of the early signs is that people notice that they urinate a bit more often. So when men come, especially men above 50 years, and they complain that, "Oh, doctor, I noticed that I urinate a bit more often," we usually like to be sure of their prostate status, and then before we now think of other things. But sometimes people can have blood sugar high, blood glucose, like diabetics. They also urinate frequently. People can have urinary tract infection. They also urinate more frequently. Some people perhaps they took alcohol or they take alcohol every night. We have seen cases like that. They are complaining, but they started their lifestyle. They say, "I can't sleep without taking a bottle of beer." So some of those things that are diuretics. So, but today we are looking at prostate cancer. So frequent urination, and then in worst case scenario, there can be blood when they pee. They say, "Doctor, I see blood when I urinate." It can also be because they have prostate cancer. Who are the people who can be affected by prostate cancer? Of course, like we have said, it's a disease of men. So it must be a man. And then it is noticed that it's common in age about 50 years and above. And of course, it's more common in blacks. So being a man, age, black race already predisposes people to cancer. But there's a theory that if people live very long, that ultimately every man may eventually have prostate cancer. That is how to, ultimately every man will have enlarged prostate. But there's another one that is now saying that if men live long enough, they are likely to have prostate cancer. So those are the risk factors for prostate cancer. Also lifestyle. People who do not have exercise, or they are too dormant in their lifestyle, there is a chance. Obese individuals, so lack of exercise and all that. Those are some of the risk factors that can predispose people to having prostate cancer. So if people have those symptoms that we have explained, frequent urination, painful urination, small dribbling of urine, blood in urine, age 45, 50 years and above, it's important to approach the hospital. So when you come to see doctor and all those things are confirmed, one of the things that the doctor can do is a simple test that we call DRE, digital rectal examination. The doctor will stick a finger on the anus of the man to be able to, because through the anus rectum you can assess the prostate. So you see, the doctor will feel that prostate to know if it's enlarged. In fact, by experience, a doctor can be able to guess that this might be cancerous and not just benign based on the texture that is felt. So digital rectal examination is one of the tests that doctor does, at least to confirm that truly these symptoms that the patient is complaining of is as a result of enlarged prostate. So those are some of the one of the tests that can be done. Again, it's advisable that every man 40 years, 45 years and above should do their PSA. PSA is a test that's also used to check the prostate. If it is the value is a certain level, I mean, it can also raise that suspicion of it. So PSA is done as a lab test. There are other tests, other investigations that can be done. If, for instance, a scan can also be done to see the volume and the size of that prostate. You know, so all those are going to help to make those diagnoses. But ultimately, what is called a biopsy will be what will confirm that prostate biopsy is going to confirm that this is prostate cancer. So, and someone will ask, oh, so when we notice that you have prostate cancer, what do we do? How? So get to the hospital if it is confirmed. Treatment, there are many treatments that can be given. Of course, like many cancers, in prostate cancer, which of course is one of the commonest cancers in men, early detection is key. If it's detected early, sometimes it's slow growing, you know. So sometimes a surgery needs to be done and it's taken out. When it's taken out in bulk, and that's why we can say that it's curable. When it's taken out, when it has not spread, you will be surprised that the person lives normal. People say, how normal? Say it lives a normal life because the problem has been solved. So that is why we say prostate cancer is one of the cancers that, if it detected early, can actually be taken care of. Sometimes also we can go to the extent of chemotherapy, radiotherapy, and all those therapies we use to take care of prostate cancer. So, and then other rehabilitation depending on the stage of it. You know, sometimes it can become complicated, especially if it's detected early. In addition to the urinary symptoms, it can also spread to affect organs around the periphery. In fact, it can even make people, it can affect the spine. Sometimes you can see someone that is on wheelchair and say, oh, he cannot walk, he used to walk. Outside tuberculosis or trauma, accident, prostate cancer can also. So when we see people who for instance, are bedridden, let me use the language that people can understand, and they can't walk, their legs are weak. So in addition to thinking of, oh, did you have accident, do you have tuberculosis, in men that are 50 years and above, we also think of, it can also be a pointer to prostate cancer. So those are some of the things that can be done. So how do we, what's the advice to men regarding prostate cancer? The advice will be to be conscious, to have knowledge that every man has a prostate. It is not wrong to have prostate. Prostate is very useful for men. However, prostate cancer or enlarged prostate is what we are talking of. Because sometimes people mix it up. They will now tell me, someone sent me a message just yesterday asking me, is prostate treatable? So I now told him, prostate is a normal organ in the human body. So perhaps you are thinking of prostate cancer or prostatic enlargement or prostatitis, which is inflammation of the prostate. So those are things, so it needs to be defined. Every man has prostate. Prostate is good. It helps in formation of the semen. It has its role that it does. However, when it's enlarged, that's when you will now be talking of. There are also drug medications that are given to shrink the prostate. So some people come, all that is done is to give them medications. When you notice that, oh, it's not cancerous, it's just enlarged, to shrink it, and you see their symptoms improve and they go their normal life. So sometimes it is not just to go and do surgery. Sometimes it's just medication. Even prostate cancer, some medications are given, but surgery is an option when the doctors feel that it should be done. So the men should be conscious. They should do their PSA screening. Very important. Once a man is above 45 years, he should do PSA screening, even if it is yearly screening, because that's what can help to pick it up even when no symptoms is there. So it's part of the screening that we advocate that men should imbibe to do. I mean, we encourage people to do some of these things on their birthday, because ordinarily they may not remember, but tie your health to your birthday. When they are wishing you long life and prosperity, one of the things you do to ensure long life is to do some of the tests that can help for that wishes to come to pass. So that screening is important. Then if you have any symptoms, by all means consult your doctor so that you can also be attended to. So on a final note, prostate cancer is not a death sentence. Early detection is key to survival. If you approach the hospital, doctors will always advise you appropriately. Avoid self-medication, avoid all the unorthodox treatments so you don't appear when it is complicated. You can follow up on our social media platforms. You can also reach me on the contact displayed, and at Waterfalls Hospital, Ikotun or Okota. Thank you for watching.